hip joint labral pathologies or labral damage. So the hip joint, similar to the shoulder, although different, it's ball and socket joint. Shoulder anatomy is quite different from the hip, but the underlying joint structure's got some similarities. The joint itself, the hip sits within the socket of the joint. The bony joint surrounds it. But to deepen that further, there's a labrum, and labrum is like a sock that comes from the bone of the hip joint itself out onto the end of the femur here, and that improves the stability around the joint. Now, it is possible that this sock-like structure, this labrum, can get damaged, usually through trauma. If it is damaged, then and particularly if it's damaged repeatedly, so like any soft tissue, if something's damaged, nicked, irritated, typically it will recover quite well spontaneously. It could take some time. In a labrum, could take months. But if it's repeatedly damaged and it actually has a tear in it, it can be uncomfortable. Now, the diagnosis of these labral tears has increased massively over the last sort of 10 or 15 years as imaging and investigations have improved in their accuracy. The question mark over it slightly is how relevant damage to the hip labrum is in terms of symptoms and in terms of what we should do with it. Certainly a good rehabilitation plan is the first point of call, and in the vast majority of cases this will settle symptoms. Not dissimilar to the section we've got on hip impingement. It's probably worth having a quick look at that and reading that on the website. But labral damage linked perhaps to hip impingement in some cases can be quite sore, particularly on people that are lifting the hip regularly, so athletes like hurdlers, sprinters, some football type sports, so ball sports. It's a tricky one to discuss in length without seeing the person individually. The pain can be quite significant. It can settle down usually spontaneously. There are instances where surgery can be performed on a labral tear. This is often done arthroscopically, but an arthroscopic repair in a hip is very much more complicated, quite different to an arthroscopic repair in a knee, for example. In a knee, there's a lot of space, so being able to get in arthroscopically via keyhole surgery arthroscopically is relatively straightforward. There's a limited amount of tissue and you can get straight into the area. You can put fluid in the joint so you can inflate it slightly and you can see what you're getting to. In a hip joint, if I just demonstrate on here, the hip joint, as I mentioned earlier, it's held within a bony ring. So to get to the hip joint, there has to be quite a bit of trauma to try and bring the hip away, separate the joint to be able to get in towards the labrum. So an arthroscopy in a hip is a much bigger operation, it's much more involved, and it's something that really shouldn't be considered unless other options have been exhausted. Although in some cases it is probably a sensible option.